Hello everybody, Brad here today and welcome back to Project Hospital Services at DLC. I hope you're all doing okay. I think today is release day for you guys, so please let me know when it comes out because I really am excited to see what you create in the game with the new DLC. So I've done it guys, I've finally killed a patient. I tried very hard to kill someone. Unfortunately, it was this guy here, Williams. That's an interesting name. So I'm just going to pause and then we'll talk about William Williams. So this is a really quick sandbox hospital that was already built. I just added a few bits to it. I added a lounge here in internal medicine and the special treatment unit, which is brand new for internal medicine. So what we'll do is let's have a look at pathology. Let's have a look at the pathological process, which patients will go through when they unfortunately die. Sorry, William, I'm sorry. I'm really sorry. I'm not really that sorry, but. And then we will have a look at internal medicine and see what's new with internal medicine. And on the left here, you can just see this is a brand new and one more breaking news story. So this is a new public health policy causes 15% higher insurance payments, and that's for 2 days. So this is a brand new feature of the admin department. So you get these, I think it's every day, I think you get these. A breaking news story. What did I have last night when I premiered the First Look DLC? I think I had one about, it was like environmental conditions. So it was like weather was really bad, so that increased patients. That's a really nice dynamic to the game, just to have a few more different bits to see. So I assume there is a nurse going up from pathology. So if we go on pathology, can we try and find that nurse? Autopsy history. Well, there's William, so let's go and find William. So he's up here, look, in ICU. So let's come up here and we'll wait until the nurse comes up, I assume to collect his body. So we'll wait for that to happen. And then, yes, we're going to want the post-mortem examination of patient's body to uncover the remaining hidden symptoms and the cause of death. Well, I'm pretty sure the cause of death is that I cocked it up. But anyway, so look, brand new cover over the body. That looks cool. I think that's new. Did he used to cover the body when a patient died? I'm not sure. Anyway, so yeah, he basically had really bad respiratory failure. I don't think it's going to take too long for the pathologist to find out what was his cause of death was me. At the end of the day, that was his cause of death. It was me. So let's just speed up time and we'll get him in. So I assume at first he goes into the autopsy room and then they'll go into the cold storage, or does he go cold storage first? Cold storage first, it looks like. So you're going to go on the slab or into the fridge? He goes onto the slab. Okay, right, here we go, look. Patient on pathology. Dead patient has been transferred to pathology. You can send the body to funeral services or perform autopsy to learn what went wrong. Uncover the remaining symptoms and gain experience points and money in the process. So let's say okay. I mean, we definitely want the autopsy. So we've selected the autopsy to be done. And how do we send them to funeral? Okay, and then the house this time is sent body to funeral services. Okay, so I assume we also gain money by this as well, which is quite good. Okay, so now this nurse here is transferring him over to the autopsy room, and then this doctor here is going to be performing the autopsy, I assume. I don't know why she just stood there. Okay, so he's kind of standing semi-naked, covering up the good bits. Right, what's she going to do? She's going to be scrubbing up. That makes sense. Obviously, we'll only scrubbed up. Okay, so oh my god, she's having a good old dive in there. Oh, and she's using this look, the pathology viewer, just to see what's actually gone wrong there. Okay, then she comes back. Is she going to weigh any organs or anything? Oh, so we've got $1,000 from that. Awesome. Okay, is that it? I assume that's it. Dead transported to morgue. Okay, so he's then going to go over to the cold room. And he just kind of chills there. Autopsy has finished. You can now... Oh, that's a bit of a spelling mistake. Well, you can now... They don't need a 2. You can now send the body to funeral services using a button and patient card. Yeah. So let's send him to patient services. I assume he just disappeared. I assume they don't come and collect him. I assume he just goes. Is how that works. Also, they're cleaning up a bit of blood in the autopsy room. Thank you for that. Okay, so there we go. So that was pathology. So really excited to see that more and use that a lot more. So let's go upstairs to internal medicine. Right, so this is the brand new room. So this is called the Special Procedures Unit. There's actually someone coming here right now, I think, which is pretty good timing. So I'm not sure what kind of procedures happen in here, but it does have the brand new equipment piece. Let's have a look at that, of the ENT workstation. So that's it right there. So let's read what it says for this. So ENT workstation, I'm not going to say that word, but it's a, okay, let's try. Otorhinolaryngological workstation. Nailed it. For a wide palette of ear, nose, throat involved procedures. Okay, so I think that's the only new piece. Maybe this as well. What is that right there? I can't grab hold of it. That. A thoracentesis device, a special USG guided device mainly used for thoracentesis procedures. Oh, okay. So let's wait here, and hopefully, I think we're meant to be bringing a patient in here. Yeah, so some doctors are coming in now. So let's spin around. Right, so who's coming in? So we've got here Elizabeth King. Okay, let's pause the game a second. So she's suffering from pleurisy, which is a condition when the membranes surrounding lungs become inflamed. Yeah, okay. I've read about that before. So she needs IV antibiotics and then like some anti-arrhythmetics. She's in HDU hospitalisation. We will give her all of these bits as well. Like there's lots of pain meds and stuff. But her main kind of source of treatment, I think, is this, which is the thoracentesis, which is an invasive procedure to remove fluid or air from the pleural space. That makes sense, right? So Elizabeth's pleural space at the moment is inflamed. You know, it has some kind of foreign object, like a microbe, virus, parasite, or it could be a foreign object. Then how the hell should have got a foreign object in there? But I suppose it happens. So now what we need to do is we need to give her things like the antibiotics here, to make sure that the inflammation goes down. However, we also, I assume, have to remove probably fluid, so it's probably like pus and stuff from that pleural space. So let's resume time and we'll see what this procedure involves. So I assume she's going to go over onto the operating table. So this is now in place of the operating room. You do not need an operating theatre in internal medicine anymore. And I have just built like a little small lounge to the side there, because this is where the operating theatre was, but obviously we don't need that anymore. So I assume that's about it. I assume it's basically just an operating theatre without needing a surgeon and an anaesthetologist and all that kind of jazz. Let's just speed up time a bit. She's just typing away there, isn't she, old Jessica Hill? I feel like it's... Oh no, is that done? I think that's done. Yeah, okay. So it's basically just a bit of a different operating theatre. It does make sense. So what's going to happen? So I assume, and please feel free to comment down below, guys, if you know the answer, because I certainly don't. I assume if someone comes to the internal medicine department, so let's try and find someone. That was Jessica Hill. Okay, we actually haven't got any more patients. But if someone does come to internal medicine, yeah, and no one's in the doctor's office either, and they need an operation, I assume they then just get transferred over to general surgery. I assume that's how it's going to work now. I'm not sure, so please feel free to comment down below if you have any suggestions on what might be the case. But yeah, that's a hospital. I'll save it. I'll save this hospital. I don't think we'll be coming back here. I did have a little pharmacy and gift shop down there as well. But what we'll do is either today, if I get time, I'm very busy at the moment, but if I do get time today, or it might be tomorrow, is we will start our brand new Let's Play building a hospital with hospital services from scratch, okay? So that's going to come really, really soon, but it might be tomorrow, okay? So take care, guys. If the DLC does come out today, really enjoy it. Enjoy yourselves. Have a good look at it. It's really good. I'm really enjoying it already so far. I think it adds quite a lot in my opinion, and especially for the price as well. So thank you very much to Oxymoron Games for giving me the key early. And yeah, enjoy it, guys. I really hope you enjoy it. So take care of yourselves, and I'll see you later. Thank you very much for watching the video, guys. I really hope you enjoyed it. Please consider giving it a like and subscribing to the channel down below if you haven't done so already. And please feel free to follow me on Facebook, Twitter and Instagram. Have a great day. See you later.